hello there. Please come on in. Make yourself comfortable. My name is Bridie. Now, I am a med student. I hope that's okay. Wonderful. So just tell me a little bit about what you've been experiencing. Right. Okay. That's fine. And any other symptoms? Okay. Well, I think today the best thing for me to do is to carry out a cranial nerve exam. Okay? Wonderful. I will go through each section and explain it to you the best I can. So there are 12 that I'm going to check. Okay? Alright. Like I say, make yourself comfortable. I'm going to begin. So this first one is called the olfactory test, and this is to check your sense of smell. Okay, so I've got a couple of these bottles here, and I would just like you to smell them for me and tell me what you can smell. Okay, so the first one. That a whiff. Okay. What does that smell like to you? Good. Okay, I'm gonna do another one. Now for this one, I would like your eyes closed. Okay. Alright, I've got another one here. Keep your eyes closed, please. I just want to see if it makes any difference. Smell this one for me. And what does that smell like to you? Good. You're doing really well there. You can open your eyes. So the next one I'm going to check is your optic nerve, and this is testing your vision. Okay, so what I am going to do, I'm going to check your pupil response to light. I've got a pen light here, and we're also going to do a Snellen eye chart for you to read. Okay, wonderful. So just look at the light. Very good. Look at the light. Very good. Look at the light. 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 Very good. Okay. Next, I would like you to read this eye chart for me. Just start in here. E. Good. 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 Very good. 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 really good. Can you do the last one? It's quite tricky. Very good. You actually did really, really well there. So that's fine. Don't worry. They're designed to be a bit tricky towards the end. Yes. So the third cranial nerve I'm going to check is the oculomotor. And this is to check your eye movement and pupil response again. Okay? So, for this one, I'm going to check your pupil response to light. But this time I want you to lift your eyes sort of up, down, side to side. Okay? Ready? So lift your eye up, down, side, side, up, down, side, side. Very good, just blink, blink. And check the other side. Lift your eye up, down, side, side, up, down, side, side. Very good. Okay. I'm now going to move the light. Just stay very still and look straight. Do not look at the light. Keep looking straight. Okay, very good. Next I'm going to check the trochlea, which is the eye movement. Okay? So, what I would like you to do, I've got a different light here. It's much brighter. I want you to look at the light, okay? So when I bring it in, follow it. Good. Follow the light. Good. 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 Very good. Wonderful. You're very good pupil response. So next I'm going to check the trigeminal nerve, which is the sensation and chewing. Okay? So what I would like you to do, I want you to clench your mouth for me. So I want you to go. That's it. Very good. Now can you pat your cheeks? Hold it. Clench your mouth. Very good. What I'm going to do, I'm just going to touch your face, okay? And I want you to tell me if you can feel the sensations, okay? My hands are quite cold, just to pre-warn you. Just tell me if you can feel it. Good. 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 Very good. Well done. So next is the abducens. This is the lateral eye movement from side to side. Okay? So, what I would like you to do, I want you to look on my finger here. Now keep your head straight. Look straight ahead. Do not move your head, but only move your eyes, okay? I want you to follow my finger. Good, keep following my finger. Keep your head nice and still with your eyes only. Good, blink. I'm going to try this side. Ready? Again, follow the finger. With your eyes only. Good, well done. I'm going to try with the light this time. Okay. So I want you to follow the light. Just moving your eyes only. Perfect. Well done. So next we're just going to check your facial nerve. Okay. And this is for your facial expressions and taste. So what I would like you to do first, I want you to smile. A big smile. Good. And do a frown. Really utilize your facial muscles, okay? So smile, frown, smile, frown, smile, frown. Good. Can you wink? Wink. Good. Really exaggerate it. So smile, frown, wink, wink. Puff your cheeks for me again. And now bring them in. Very good. What I'm going to get you to do now, I'm going to get you to taste a little bit of this. I'm going to drop it onto your tongue. Just tell me what you can taste. Okay. Pop your tongue out. Drop. Drop. Okay. What can you taste? Good. Well done. Okay. Next, I'm going to check your vestibuloquia. It's a very long word. This is your hearing, okay? And your balance, but I'm just going to check your hearing today. So, what I am going to do, I'm going to make some sounds behind both ears. Tell me which side you can hear it from, okay? Which side? Which side? Which side? Which side? Good. Which side? Very good. I'm now going to whisper, and I want you to repeat back to me what I say. Ready? 1, 2, 3, 4, 5. Repeat that back. Good. Cat, dog, mouse, bat. Good. Coconut, tingle, relax. Good. Coconut, coconut, coconut. Very good. Your hearing is absolutely fine, and you've generally been responding really well to me. So next, is called glossopharyngeal, I think. Now, it's to do with your sort of mouth reflex swallowing and your taste. We've also checked that already, so I won't repeat that one. So what I would like you to do is just open your mouth, and I want you to go, ah. I'm just gonna have a little look with my light. Open and say, ah. Good. Look. And say, ah. Good. Okay. Now just stick out your tongue. And can you move your tongue side to side? Can you lift it up? Very good. And now can you just do a swallow for me? Just like that. Good. Very good. You're doing really, really well. Okay. Next is the vagus, which is also to do with your reflexes and gag and everything, which we've checked. So that's almost like a 2-in-1. Okay. So next is the accessory. So this is your shoulders and your head. So what I want you to do, I want you just to do this for me. Just where you are, just where you're sitting down. Just slightly move your shoulders. That's it. You can move them up, down, up and down. Just copy me. Up, down, up, down. Move them like this. Very good. Now what I would like you to do is just move your head. Middle to side. Middle. Keep copying me. Any pain or discomfort? No? Just rub your shoulders. Good. Just move them. Well done. You're doing really, really well. Okay. Now the last one is actually called hypoglossal, and it's your tongue movement. We did briefly do this. So basically you just need to stick your tongue out as far as you can, and I need you to try and move it. Up and down. Can you curl your tongue? That's fine. Well, that is all of your 12 cranial nerves checked. Do you have any pain or discomfort? Everything generally looks fine. Thank you so much for letting me carry out this test today. What I would say is just keep an eye on your symptoms. I'm not concerned, but if they do get worse, please do come back. Okay. Great. It was lovely seeing you. Take care. Bye-bye. Bye-bye. Oh, hello there. Please come on in. Make yourself comfortable. My name is Bryony. What's your name? Yes. So you're here for your eye examination? Wonderful. Now, have you been experiencing anything unusual? Anything out of the ordinary? How about any symptoms of any kind regarding your eyes? Any blurred vision, double vision, watering or redness? Okay. Alright. Well, just make yourself comfortable there. Okay. I'm going to put on some gloves. Okay. I'm going to get a little bit closer to you. Just going to start by feeling around your eyes and just making sure there's no lumps or bumps or anything, okay? Alright. Is it okay if I just have a feel around? Wonderful. Do let me know if you have any pain at all, any discomfort. Just around your eyes. Pain or discomfort? Okay. Okay, well that feels fine. What I am going to do, I'm just going to do some tests just to check your eyes, your peripheral vision, and just make sure your eyes are okay. Alright. Wonderful. To begin with, I want you just to look here, look here, look here, look here, look here, look here, look. Very good. Look here. 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 Good. Look at the light. Look at the handle. Look at the switch. Look at my nose. Look at my mouth. Look at the light. Look at the rabbit. Look at the handle. Look at the switch. Look at my mouth. Look at the light. Very good. Just blink. Blink. Okay. Now I want you to tell me if my hands are close or far away. Okay. Good. 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 Very good. Okay. Now, I'm going to hold my fingers up. I want you to look straight at me with your peripheral vision. Tell me which side wriggles. Okay? Ready? Which side? Good. 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 Very good. Okay. Now I want you to tell me how many fingers I'm holding up, okay? 4. Good. tell me when you can see my fingers in your vision. Okay? Good. 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 Very good. Now we're going to do the opposite. Tell me when you can't see them, okay? Good. 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 Very good. You can blink, blink, blink. Alright. What I'm going to do now, I'm going to have a little look into your eyes. Do not look at the light, okay? You can look straight at me. Lovely. Okay, do not look at the light. Okay, I'm just gonna check this side. Again, do not look at the light. Okay, could you just look up for me? Okay, look down. Look left. And look wide. Okay. Alright, could you now just look at the light? Look at the light. 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 Okay, now I would like you to follow the light. Follow the light. Good. Good. Okay. Look at the light. Now follow the light. Follow the light. Follow the light. Follow the light. Okay, very good. You can blink, blink. I'm going to use a brighter light. This one is blue, okay? what I want you to do is just look at the light. 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 Okay. I want you to look at the light. Now follow the light, okay? Follow the light. Follow the light. Follow the light. Very good. You can blink, blink. Alright. I have an eye chart here, and I would like you to try and read it for me. Okay. Good. 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 Very good. How about these ones? Are they a little bit tricky? Okay. I might have something to help. What I'm going to do I'm going to pop these on you. Okay. And I'm just going to see if I've got any lenses that will help your vision. Okay. So let's pop these on you. That's it. Pop those on. Alright. Now I'm just going to adjust them slightly. Okay. Okay. Got the glasses on. Okay. So now what I'm going to do, I'm just going to try these different lenses. I'm just gonna slot them into place for you. So, just tell me if this makes any difference. Is it clearer? A bit more blurry. Okay, try this. Clearer. Interesting. How about Clearer? More blurry? A little bit blurry. Okay. Let's try this one. Ready? Is that better? Or worse? Better or worse? Is it better without? I think you might have perfect vision, 20/20 vision. Just tell me what colour this box is. Good. This one? Good. Okay. What I'm going to do, I'm going to take off those glasses if that's okay. Is that alright? You do look really cool in them, I must say. Alright, ready? Okay. Alright. Now what I would like you to do is tell me what you can see on these charts. Just checking for colour blindness, okay? So, what number do you see in here? 12. Good. How about this one? This one is 6. It's quite difficult. Okay. What about this one? It's 29. This one? Good. Okay. How about this one? It's 5. Okay. What do you see here? Okay. How about here? What do you see? Okay. How about here? Good. Alright. That part is fine as well. Some of them are designed to be quite difficult, so don't worry. Well, that is the end of your eye test. You've done extremely well today. You do have very good vision, so I'm not concerned at all. However, if you do get any symptoms, any blurred vision, double vision, redness, watering, swelling, that kind of thing around your eyes or in your eyes, please do come back to see me, okay? Alright. Thank you so much. Bye-bye. Oh, hello there. It's me, Bryony. It's so lovely to see you. Please just make yourself as comfortable as you can. Okay. I'm just going to do the cranial nerve examination. Okay. I'm just going to put some gloves on. Now you might be able to hear the rain. There's a bit of a thunderstorm going on. But it's okay. We're in the warm. Alright, so I've got my gloves on. Now, have you been experiencing anything unusual? Anything out of the ordinary? Okay. Anything you think I should know about before I begin? Okay. Alright. Well, have you had any issues with your vision? Any watering in the eyes? Double vision? Okay, what about your sense of smell or taste? How about your hearing? Any changes? Any worries? Alright, don't worry, I'm going to do a thorough check and make sure you're okay. You can just sit back, relax, I'll do everything, okay? Well, first I'm just going to check your breathing, okay? So just before I do that, can you take a nice deep breath in for me? And out. Good. Take a nice deep breath in. And out. Good. Just try and stay relaxed for me. So I'm just going to pop these on. I'm just going to have a little listen to your chest with my stethoscope, okay? So just lift your top for me. Okay. Just breathe normally, okay? Good. The other side. Okay, take a deep breath in. And out. Okay, can you do a cough? Wonderful. Your breathing is absolutely fine. I'm not concerned with that. Have you had a recent infection or anything? Okay, well, everything sounds fine. You don't sound congested or anything at all. Alright. Wonderful. Okay, so now I'm just going to quickly just have a little feel around. Let me know if you've got any pain or discomfort, okay? Does that feel okay? Pain or discomfort? Okay. It's gonna touch your face. Alright, I'm just going to feel your shoulders. And now your arms. Again, do let me know if you have any pain. The other side. And I'm just going to put some pressure on your chest, okay? And just feel your tummy. Okay, I'm just going to press on your tummy. It might feel a little unusual. Okay, that's fine. And just your thighs. They feel okay, no muscle cramp or anything. Good. Okay. Now what I would like you to do for me, could you just bring your shoulders up, down, up, and down. Very good. Can you just do one, roll it back, the other one, roll it back. Good. Can you lift your feet off the floor? Just like that. Very good. Well done. Okay, now just turn your head side to the other side, side to the other side. Good. And up and down, up and down. Very good. Any pain or discomfort there? No? Alright, good. Okay, I'm now just going to touch your face and just tell me if it feels sensitive or anything, okay? How does that feel, okay? Good. Alright. I'm now just going to rub the skin. Tell me if it feels sort of tingly or just uncomfortable, okay? How does that feel? Good. Okay. Could you just do a smile for me? And a frown. Really move your facial features, okay? Can you do a wink? And a wink. Good. It's a smile. Frown. Wink. Wink. Good. Can you puff your cheeks? Good. Can you bring them in? Good. Can you open your mouth wide? And say, ah. Can you move your tongue? Side to side, up and down. Very good. Okay. What I'm going to do now, I'm just going to have a little look into your mouth. Okay. Just keep your mouth open for me. Just going to use the slide. Okay. Open your mouth. Good. And just say ah for me. Ah, very good. Yeah, that's fine. You can close your mouth. Okay, I'm just going to have a little look into your eyes. Okay, so can you just look straight for me? Do not look at this light, it's very bright. I'm just going to check the other side. You go very good. People response. Very good. Can you look up? Okay, now look down. Look left and look right. Very good. Okay, I've now got this brighter light. Could you just look at the light? Look at the light. 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 Very good. Can you now follow the light for me? Let's keep your eyes on the light. Very good. Follow the light. Follow the light. Follow the light. Very good. Follow the light. Keep following the light. Very good. Keep following, keep following, keep following, keep following. Follow the light, follow the light, follow the light. Very good. You can blink, blink, blink. Well done. Okay, just look here. Look here. Look here. Look here. Okay, look at my finger. 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 Okay. Can you now follow my finger? Very good. Just keep following. Keep following my finger. Very good. Keep following. You're doing really, really well. Keep following, keep following, keep following, keep following. Good. Okay. How many fingers do you see? How many? How many fingers? How many? How many? How many fingers? How many? Perfect. Well done. Okay. I'm now just going to whisper in each ear. I want you to repeat back to me what I say. Okay. 5, 10, 8, 2. What did I say? Good. Cat, dog, mouse. Good. Apple, banana, orange. Good. Coconut, tingle, sleep. Good. Coconut, tingle, sleep. Very good. Okay. I'm now just going to make some sounds behind your ears, and I want you to tell me which side you can hear it from. Okay. Ready? Which side? Which side? Which side? Good. 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 Very good. Well done. Next, I'm going to use this, and I'm just going to make some sounds, and I want you to tell me whether or not you can hear it, okay? Just going to be very gentle, okay? Can you hear that? Good. Ready? Did you hear that okay? Good, okay, I'm a little bit gentle. Did you hear that? Good. You can hear that. Wonderful, thank you. next I'm just going to check your sense of smell, okay, and taste. So first of all, I want you just to smell this one for me. What does that smell like? Good. Okay, we'll get another one. What does this one smell like? Very good. Okay, I'm now going to get you to taste a couple. Okay, so taste this one. Ready? Drop. Drop. What does that taste like to you? Good. Okay, let's do one more. Okay, ready? Drop, drop. What does that one taste like? Good job. Well, you have done really, really well today. I don't think there's any concerns at all. You've passed the cranial nerve exam. Okay. If there's anything else, or you have any worries or concerns or any symptoms develop, please do come back to see me. Okay. Alright. Well, take care. Bye-bye. Hello there. Please come through and make yourself comfortable. My name is Bryony. So, tell me about what you've been experiencing. I've had a little look through your notes, but I would just like to hear it from you. What symptoms have you been having? Like palpitations. It's almost like a little flutter, or you can sort of feel your heartbeat. Yeah. Okay. And how long have they been lasting? How long have you been feeling like this? Okay. Okay. And is there anything else you think I should be aware of? Okay. Generally, do you think you have quite a fast heart rate? Do you feel it quite a lot? can see from a recent ECG that it's normal, you're in normal sinus rhythm. It wasn't fast at the time, so yeah, that's something. Okay, alright. Well, based on what you've told me, there's a few things we can do for certain. But what I'm going to start with, I'm actually going to just check a few things like your pulse, okay, and your oxygen saturation levels, okay. So, what I'm going to do, just going to check your pulse. So I just need the side of your wrist there. So I'm just gonna slightly push. Sorry, I've got very cold fingers. Just gonna put a bit of pressure. Okay, your heart rate is slightly elevated. It is currently 94. So that could be because you're here with me. You're a little bit maybe anxious or nervous. But overall, I'm not too concerned. It's not over 100. But we'll keep an eye on it. It is slightly fast, a little bit. So what I am going to check next is your oxygen saturation levels. Okay. So I've got a little oximeter here, and what I would like you to do is just pop your finger in, just like that, and it will tell me your oxygen saturation. Okay. So just pop your finger in there for me. That's it. And it's just gonna close. Just hold that on. Wonderful. Okay, just take a deep breath in for me. Good. Wonderful. Your oxygen saturation levels is 99%, so that's very good. I'm just going to take that one off. Perfect. Alright. What I'm going to check next is your blood pressure. Okay. Is that alright? Wonderful. So I have got a blood pressure cuff here. Alright. So what I would like you to do is just pop your arm into this cuff for me. Alright. So that's it. Arm all the way in. Lovely. Just going to close that. Perfect. And just relax your arm by your side. Alright. Okay. So I'm just going to pop my stethoscope in. Now it will inflate quite tight, okay, but I will deflate it, so don't worry. It can be a bit tight and fast. I'm just going to pop this in. Lovely. I'm just going to pop that just under the cuff there. That's it, just where your main artery is. Lovely. Okay, so I'm now going to inflate the cuff. Okay. Wonderful. Okay, just slowly releasing it, so you should start to feel it go down. Just waiting for your systolic. Good. Good. And the diastolic. Wonderful. That's great. Let's take that away. Pop that around. We'll just take this one out of your arm. That's it. Pop your arm out. Good. Slide it. That's it. Wonderful. So your blood pressure is actually completely fine and normal. It's 120/80. So it's perfect. So what I am going to do, I'm just going to have a little listen to your chest. Okay. Just before I do so, take a nice deep breath in for me. And out. Okay, deep breath in. Good. Okay. So just lift your top for me. That's it. I'm just gonna pop this on there. Okay. Okay. Now the other side. Okay, that's fine. Okay, take a nice deep breath in. And out. Good. I'm just going to check this side again. Take a nice deep breath in. And out. Good. I'm just going to put this on your back. Okay, and back on your front. Could you just do a cough for me? Good. And again. Good, okay. Just breathe normally. Yeah, that's fine. Okay. Well, you'll be pleased to know that everything sounds fine. So generally everything today seems okay. Your oxygen saturation's fine, your blood pressure was fine, everything sounds fine, you don't sound congested or anything. The only thing I'm a little slightly concerned about is your heart rate, but that might have elevated just because you're here with me. So what I will do, I'm going to request for you to have another ECG in a couple of weeks. Also another set of routine bloods. And I think I'm going to request for you to have an echocardiogram. An exercise test on the treadmill. And also a 72-hour Holter monitor. So this should help us to finally figure out why, or if your palpitations or the feeling that you're feeling is heart related. Okay. Wonderful. Well, thank you so much for visiting me today. You will receive all of these tests as an appointment in the post. Okay? Wonderful. Well, thank you so much. And if you need me, you know where I am. Bye-bye. Hello there. Sorry, I know it's really late tonight, but it's that time. I need to check your observations. Okay? Wonderful. I really didn't mean to disturb you. So I do just need to check your blood pressure, your heart rate, your temperature, your oxygen saturation level, and your respiratory rate, okay? Wonderful. Alright. You just relax where you are. I'll do everything, okay? If you want to close your eyes, that's absolutely fine, okay? Now, do you have any pain? Okay. Are you comfortable where you are? Good. Alright then. Okay. So, to begin with, I'm just going to check your respiratory rate. This is how many times you take a nice, natural, deep breath in and out, okay? So you just relax where you are, and I will count that. 2, 3, 4, 6, 7, 8, 9, 10, 12, 13, 14, 15, 16. Good. So about 17. That's perfect. That's exactly where I want it to be. That's absolutely fine. Okay? Wonderful. So next I'm going to check your temperature. I do have the tympanic here. Just going to change the settings. Okay, this one's just going to go on your forehead, okay? Good. .7, okay, is your temperature. That's absolutely fine. I'd expect for you anywhere between 36.2 to about 37.3, okay, so you're more than fine. Next up, I'm just going to pop this one just on your finger, okay. I'm just going to check your oxygen saturation levels, okay. So if you can, just pop your finger in there for me. That's it. And just hold your hand out. So a normal oxygen saturation level should be above 96% to 100%, okay? But if you were to have any breathing difficulties or lung conditions or anything, that can bring it down. Just take a nice deep breath in for me. And out. Okay, take a nice deep breath in. And out. Wonderful. Your oxygen saturation level is 98%. Now it's actually saying here that your heart rate is 79. I will check that manually, okay? So I'm just going to take that one off. Lovely. Now, the only thing I'm going to check next is your pulse and then your blood pressure, okay? And then you are free to go back to sleep, okay? So I just need your wrist. Just gonna check your pulse. Just want to feel it. 1, 2, 4, 5, 6, 9, 10, 11, 12, Well, that's pretty accurate to the oximeter, so it's about 80, okay? Now your pulse feels regular, okay? I didn't feel any sort of ectopics or anything, so I am going to check your blood pressure now, okay? And that will be the last thing I check. Everything is looking in range and normal, okay? So we'll just see how your blood pressure is. So what I do need you to do, I need you just to pop your arm in here for me. So just, if you can, slide that on and all the way up your arm. Good. Now you can just relax your arm down, okay? Just by your side for me. So I do need to hold that one. That's it. Perfect. Okay. I'm just going to get my stethoscope. The other way. That's better. Okay. So, just going to pop the stethoscope just there. on your main artery, just under the cuff. Wonderful. Okay, now I am just going to inflate the cuff. It will go very, very tight, just to pre-warn you. Okay. Are you ready? Just gonna pump it up. Okay, slowly going to go down. Perfect. Okay, so your blood pressure is about 126/74. Okay, so that's fine, that's okay. Alright, so what I'm going to do, just going to take that one off you. So just take your arm out. Good. Alright. Just put that back round. Okay, so I've managed to check your observations. Okay, everything looks fine, everything's in proportion and normal. I'm not concerned at all. So I will now let you just go back to sleep. Okay, but you're absolutely fine. There's nothing to worry about. If you need me at all in the night, you know what to do. Alright, bye-bye. time. Okay. I'm here to see how you're getting on. Sorry, I know it's the middle of the night, but I have to do my night rounds. I'll just let you wake up. Sorry. Other than being quite tired at the moment, how are you feeling? Okay, alright. And do you have any symptoms at the moment? Okay. And how's your sight from the surgery? Is it healing nicely? Can I have a little look? Oh yes, that's healing good. Alright. Well, I've looked at your recent blood results. Everything looks fine, normal, nothing to be concerned about. Okay. Your ECG is fine, normal, sinus rhythm. Okay. I think you are on the mend. By the looks of things, you will be able to go home soon. Yeah. Now, I just want to do a quick examination, if that's okay. Just to make sure you're generally alright. Is that okay? Perfect. So I'm just going to check your temperature. Okay. That's fine. Your temperature is 36.5. Now, just going to check your oxygen saturation levels. So if you can, I need you to pop your finger in here for me. That's it. Pop it in there. I'm just gonna hold it on for a few moments, okay? Take a nice deep breath in for me. And out. Very good. Take a nice deep breath in. And out. Good. Wow. Your oxygen saturation is 100%. Well done. That's very good. Let's take that one off. Your heart rate is also 86. A little bit elevated, but nothing to be concerned about. It's probably because I've just startled you. So next up, just getting my pen lights. I've got a few here. So just look straight at me, okay? Don't look at the light. Okay. you see the light on? Okay. How about now? Is it on? Good. Okay. Is the light on? How about now? Tell me when the light goes on, okay? Good. 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 Well done. Okay. Now I'm just going to use my other light. Okay? Now, do not look at the light. It's going to be very bright, okay? I'm just checking your pupil response. The other side. Could you just look up for me? Look up. Okay. Now look down. Okay. That's fine. Okay. Just look at the light. 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 Very good. Okay. Now I'm just going to use a much brighter light. Okay. This one is blue. Do let me know if it's too bright for you, okay? Do you see the light? Good. Okay, look at the light for me and follow the light. Follow the light. Very good. Keep following the light. Okay. Very good. Well done. Okay. What I would like you to do now is just take a nice deep breath in. Good. Take a nice deep breath in. in. How does that make you feel? Do you feel dizzy, lightheaded, or are you okay? Good. Alright. I'm just going to have a little listen. Okay. To your chest. Okay. So just lift your top up slightly. Good. I'm just gonna pop this on your chest, okay? Okay, take a nice deep breath in for me. And out. Very good. Okay, I'm just gonna pop this side. Okay. Wonderful. Okay, take a nice deep breath in. And out. Good. Okay, I'm just gonna pop this lower down, okay? Just listen to your lungs. Just breathe normally for me. Good. 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 Okay. That generally all sounds fine. You don't sound congested or anything. So it seems like you're actually on the mend. And I think you will be out of here soon. Yeah. Now, I just want to quickly ask you some questions. Okay? It's more for cognitive functioning. Alright. So, what year are we currently in? Good. And what month is it right now? Okay. Can you name me 3 vegetables? Any 3 vegetables? Very good. And can you name me 3 fruits? Very good. Now, can you name me an animal? Any animal of any kind? Beginning with the letter S. Good. And can you name any animal beginning with the letter C? That's okay, good. Well done. Okay. Alright. Now, can you tell me an object that I might use to write with? Any object? What could I use to write something? What's the object called? Good. And what might I use to write on? Wonderful, well done. Okay. Now, what I'm going to do, I'm just going to check a few more things, okay? So, just for your facial nerve, alright? What I would like you to do is just copy me, okay? So do a big smile, and a frown, and a smile, and a frown. Can you wink? Wink. Good. Can you open your mouth wide and say, ah? Very good. Can you puff your cheeks? Good. Can you bring them in? Good. Okay, now move your head from side to side and up and down. Can you move your shoulders for me? Good. Any pain or discomfort? Good. Alright. Well, that's everything I'm going to check. So, you can actually go back to sleep now. Alright, I'm just going to finish up your notes here. So, everything I've checked is absolutely fine. The temperature's fine. Your oxygen saturations are fine. Very good. Breathing, everything sounds fine. You don't sound congested or anything. People response is great. Cognitive skills is good. And you've got no problem with your movements. Well, I think you're ready to be discharged from the hospital. We'll probably just monitor you tomorrow, and hopefully you'll be out of here soon. Okay? I'm so sorry again for disturbing you. I know how important your sleep is. I will review you again in the morning, okay? Alright, well, good night. Good night.